Skin is only a mirror, it reflects your internal health. Hi, I'm Dr. Bindu Sthalekar, dermatologist and cosmetologist, and today I'm going to talk to you on face mapping. All of y'all must have heard of acne vulgaris, or the common acne which occurs during teenage years, that is from 13 to 18 years of age. That is the common acne. But some of y'all at the age of 20, 25 must be still wondering, why do you keep getting acne or pimples or zits at the same spot and it keeps recurring? So today I'm going to help you identify the cause of that persistent acne occurring at the same spot. First of all, we divide the face into sections. It is divided into the forehead, it is divided into the area between the eyebrows and the eyebrows, the nose, the cheeks, around the mouth or the perioral region, chin and the jawline. These help to identify why pimples are occurring at the same recurring spot. Sometimes you do see many zits all on the forehead, and they are caused by a fungus. The fungus not which you are thinking of. This is a fungus which is normally present on the skin and on the scalp, and it tends to overgrow in times of humidity or stress, and it migrates down onto the forehead and along the hairline margin, and this is called Pityrosporum folliculitis. Now when this is seen, all you have to do is wash your hair twice or 3 times a week with an anti-dandruff shampoo. Stay away from too much sugars and stop applying any applications like greasy applications on the scalp, because this is not agreeing with you, and this is promoting the overgrowth of this Pityrosporum. Next we come to the eyebrows, and between the eyebrows, very rarely some people get deep pimples or deep zits under the eyebrow or between the eyebrows, and that is A, because of stress, and B, if they've had too much sugars in their diet. So stay away from refined foods. Next we come to the nose. The nose, the most prominent area on the face. Now this, sometimes you will see just a general redness, and occasionally this redness spills over onto the cheeks, or sometimes you may get some zits or some pimples on the nose, and this is an entity called rosacea. This happens because of acidity in the stomach. Rosacea can occur periodically again and again. So for that, you have to be a bit more careful, take a little bit more precaution. Use a mild face wash, use a sunscreen, topical application of metronidazole and azelaic acid helps the redness and helps and prevents the pimples from forming on the nose. It can occur because of stress, sunlight, spicy food, spirits, too much of alcohol, and the 3 C's: coffee, cheese, chocolates. Stay away from all these factors and you are going to clear your nose. Secondly, sometimes people have a lot of rash on the cheeks, small red dots they keep getting, and that could be because of too much of sunlight. Say at the age of 20 or 22, they have only blackheads and whiteheads, and this is because of application of comedogenic creams or makeup which has not agreed with their skin, and this goes by the name of acne cosmetica. So what you have to do is you have to stay away from greasy cosmetics, or if people who are getting this recurrently, anything they apply on the face, the creams should say non-comedogenic. And yes, you do get creams saying non-comedogenic, you do get makeup saying non-comedogenic, and stay away from creamy cosmetics, and you can use liquid or lotions. Nowadays, the bane of everyone is the cell phone. We have a lot of people coming with acne on the sides of the ears. That is because of constant use of the phone. So this is either you'll use the hands-free, wipe your phones regularly And this also is caused by friction, because when you hold the phone or when you wear anything which is causing friction on your skin, that occludes the oil glands and the sweat glands, and that leads to the zits or the acne. You can use antibacterial face washes, and these antibacterial face washes also will help if you've got acne coming up around the mouth, that is zits all around the mouth. This is called perioral dermatitis, and this is because of some people who have oily skins. They apply a lot of greasy cosmetics, a lot of creams, too much of fats, too much of sugar in their food. This leads to an overgrowth of a gram-negative organism. So therefore, this leads to what we call as gram-negative folliculitis. This is a mite. Of course, when this occurs, when you see it occurring constantly around the mouth, you need to see your dermatologist, because then you need to be prescribed a medicine. But stay away from sugars and stay away from too much of greasy food and application of greasy creams on your face. You do see people on the chin getting a lot of zits, and along the jawline. You'll see big zits along the jawline, and some people just explode 1 week before the period, and this is a hormonal acne, and this is almost akin to PMS, that is premenstrual syndrome, an entity where you need to find out exactly when it occurs, and if they are deep pimples or deep zits, they are definitely due to a hormonal cause, and in girls it is PCOS or polycystic ovarian syndrome. Rarely, abnormality of the thyroid also can give rise to these deep zits along the jawline and the chin. I'm going to now add over here, these are not zits, but some people do get a lot of redness along the nose, or a redness and scaling on the eyebrow and on the eyelashes. This is what we call as seborrheic dermatitis. Of course, big names, but conclusion is that this is because of too much of sugars, too much of rich food, greasy food, and too much of alcohol. So stay away from it and your skin will glow. Acne products will help you if you have existing zits. Creams containing benzoyl peroxide or adapalene help, and face washes which help any acne which is on the face is salicylic acid face washes. You can use that twice a day. So now when you see your acne or your zits coming again and again, recurring at the same spots, face map them. Identify the cause. Eliminate it, because till you eliminate the cause, you're not going to be free from the acne ever. Treat yourself, apply the right things, refrain from the wrong foods, the diet, stay away from the culprits, and you are going to get a glowing skin. Until next time, stay tuned, stay glamorous.